we're really pretty fast on the neck, and we do a pretty quick feathering. And I don't really like to treat the neck, although patients like it. And I can't think of anybody who's ever complained about their results. But I'm usually pretty tired when I get finished with the face. And I personally think rejuvenation of the neck is generally a surgical issue, either a lipo issue or it's a skin lifting issue. But certainly you can get some great rejuvenation of the neck with fractional CO2. And I'll go all the way down the neck with the equivalent of 1.5 passes, however you accomplish it. 1.5 passes of 20/20, again, 8 index, which is 2,500 on the pulse width. That goes out saying all these passes are 2,500 or 8 index. And then on the neck, I'll do 1.5 passes with a 20 watts, 20%, 180 spot size, 180 scanner. And I'll go down all the way down the neck, and I'll kind of feather onto the chest. But over the average, it's 1.5 passes. Let's see, that was a great question. What's my approach to Fitzpatrick skin 2? Let me just kind of mention, I don't know if somebody asked this, but there's a lot of, no matter what you have in your practice, you may just do facial aesthetics. That might be your thing. You might be a surgical specialist. You might be non-surgical in your approach to the face. In my opinion, face is just something that no matter what you do, you can do better. You can add more techniques. More minimally invasive techniques is what patients want. But minimal surgery is a really, really great thing. And, they got terrible jowling. Here's what you say to them. I'm not a surgeon. Or, I am a surgeon. What my recommendation is that eventually you have at least a small incision facelift, if not a, small incision with an extension on your neck, because that's the only way that this part of you is going to really look exquisite. But, again, whether you're a surgeon or a non-surgeon, you will have so much credibility that comes to you if you tell that patient, I think you need a lift. But when you look at the risks of a lift, when you look at the cost of a lift, when you look at the recovery of any type of surgical lifting, I don't know anybody in America that if they really objectively looked at it, wouldn't first say, let me spend the $6,000 or the $10,000 on resurfacing my face and volumizing my face. I can do the incisions later. That's always the order I do it. Even if I'm going to do a small incision facelift on a patient, that always comes later. It's not going to be any skin off of your back to have a loyal patient to you. Put your facelift off to later, or refer the patient to your surgical colleague and just tell them from the beginning, this is the referral that I make after we make your skin look younger and we do the volumization, because that's what the paradigm shift in facial aesthetics is. The paradigm shift is people look more natural when you fill them and when you take away their aged skin. If somebody has aged skin and they're devolumized and you try to only do surgery on them, they look horrible. So our surgical colleagues that are really, really good at doing surgical lifting, they're losing patients left and right if they're not given the priority to what it deserves, which is volumization and resurfacing, rejuvenation of the skin. So anyway, put things in the right order. Whether you have a surgical background or a non-surgical background, it's all the same. Surgery's later, whether it's done by you or whether it's done by a colleague. You're going to make a friend for life if you use the Mixto properly and you make sure to volumize the patient properly. Let's see if I've got another question here. That's the same question. I'm a little disappointed that I don't have more questions. Nobody's flirting with me on this instant messaging thing or anything. So anyway, I'm going to ask the host if is that you, Rob? If there's anything else that anyone has messaged to you, Or
Yeah, there's one question that came in. I think you've covered it mostly, but is there any special precautions, techniques for the darker skin types, 3s, 4s, 5s, 6s?
Yeah, so again, I think that more than likely you could use some appropriate settings on any skin type and you could get some improvement. But you know what? I love patients. I want them to love me. My average skin type 5 or 6 patient that comes in that's asking for an improvement in their face, they probably need to have me do something else on them. There's no reason not to stick with your sweet spot. And when I have a 5 or a 6 patient, or even sometimes a 4 patient that comes in, the question shouldn't be, can I get away with this if I'm really, really slick and I do enough test spots and stuff like that? The question is, whether you're sophisticated enough of a facial aesthetics provider that it doesn't always have to be about the laser. Sometimes it can be, they come in because you've got the whiz bang laser, and the guys at lasering would love for you to send them some great before and after pictures, even though they've got a million of them. At the end of the day, all you really need to care about in that consultation room with the patient is, are you telling the truth to your patient, and are they going to be happy when you get finished? Fortunately, people wear their face on their face. Everybody's seeing it all the time. You can't hide it. You can't put it away. So patients don't want to cut back on quality. They want you to recommend to them what they need for their face to look natural and to look good, no matter what they need. So give them good advice. If that means tell them not to do the Mix 2, show them your Mix 2 pictures, and they'll love you because they know you're doing the best work on the block or the city or your county or your area of the state or whatever, and use your Mix 2 pictures to credential you, but then give the patient what they really need, not what they want. And most of your patients that are skin type 5s and 6s, you're going to turn around the conversation. You can say, yeah, I could do laser on you. We're going to do some testing with you. Your particular scar issue, fill in the blank. Your particular sagging issue, bags under your eyes, whatever it is, have got some other solutions too. Now, I'd rather put the laser to the side right now.
Yeah, I think we'll take one last question. We're running a little long here, but you might see it at the bottom. Do you leave the serous crusting and remove it as the patient's heal?
That's a great question. Yeah, we could talk for about 30 minutes about everything that I've gone through to figure out how to pre-treat patients before laser, what to use occlusion, something mechanical or a barrier. Do you use a petroleum-based product? I figured out a lot of that, but I'm still learning. And at the end of the day, what I can tell you is, no, I'm not going to remove anything off the patient's face. I'm going to let them bathe their face in the right product, and I'm going to let any of that eschar just sort of melt off. And really, at the end of the day, you can see from the series that I showed you on my esthetician, they really just for gentle washing of their face between reapplications of topical skin care, they don't really have a lot of problems with serosanguinous, eschar and things drying up and being cakey like that. There's not really an issue with that.
Well, Dr. Laurence, I think that was a fantastic presentation. I do want to tell everybody that we have recorded this event, so if you want to view it again, you can go to the lasering website. Please allow us a couple of days to put it up. If you have any more questions, Dr. Laurence provided his email address, superdoc@gmail.com, or you can call us at lasering, and we can answer any of your questions there. Also want to remind everybody there's a special financing program, payments as low as $800 per month. You can contact us for more information there. We are opening up a poll at the right of the screen. If you have, we've asked that you please take 2 minutes to fill out the poll. That helps us better create these events to fit your needs. And Dr. Laurence was just